This evening's Board of Education meeting was canceled as part of the efforts of the Ann Arbor Public Schools to slow the spread of COVID-19 by limiting large gatherings of people. However, we still wanted to share this important health update regarding COVID-19 to the Board of Education and the community. Sharing information tonight are Dr. Janice Swift, Ann Arbor Public Schools Superintendent, Jenna Bacalor, Executive Director, Student and School Health, Keely Hoffman, Ann Arbor Public Schools Lead School Nurse, and Dawn Linden, Assistant Superintendent of Instruction. You may notice our panel is spread out further than is typically the case for a TV broadcast. This is an intentional decision to demonstrate social distancing to help slow the spread of COVID-19. We now turn to Superintendent Dr. Janice Swift.
Thank you, Andrew. We appreciate you all joining us this evening. I apologize for the delay. We had a very high demand on our live stream, and unfortunately our system had a problem, but we've regrouped, and I just want to emphasize that this video recording will be available for everyone in the community to watch. It will be available on our website later this evening. So thank you for being with us. You all are aware, you've received our previous briefings, that over recent days, members of our team, our Ann Arbor Public School team and I have been working, preparing for a more significant phase of this COVID-19 situation. We've been working vigilantly and doing our best to communicate with our staff and parents, our students, and our community. And I believe it's clear to everyone that with the governor's announcement overnight declaring the first two confirmed cases in the state of Michigan, with her declaration of a state of emergency for Michigan, and then today the World Health Organization declaring COVID-19 as a global pandemic, I believe that we can agree that a more significant phase has arrived, and it has arrived in Ann Arbor. We understand that very serious situations like this are likely to impact almost every aspect of our lives. So we will reiterate that we will hold fast to our top priority of student safety, student and staff and community safety. And we will continue to look, I know, as a community, for ways to help one another. We have so many questions this evening, and I just want to clarify, I know the trustees have joined us live, and they will be signing in with questions, and we'll do our best to respond to questions. I'm going to open with the introduction, and then we'll move toward a health update. Health, safety, and well-being are top priority. Jenna and Keely will share that. And then we'll move over to our critical mission of teaching and learning, and then into some logistics about school activities and athletics with our Assistant Superintendent, Dawn Linden. So that will be kind of our organization. And then, of course, as we do every Wednesday night, we'll open up for the trustees' questions or any other thoughts that we need to consider. Again, this broadcast will be available for everyone in our community to see. You know, there's so many questions that we don't have answers to. So I want to acknowledge right away at the beginning of our time together that there will probably be more questions that we aren't able to answer yet. In fact, there's so much about this situation that we do not know. We are working with disease experts and with our public health authorities every day, multiple times per day, to clarify our current situation and to work on the best and wisest next steps, understanding the role of the school district in the community. So we understand that there's a lot more that we don't know about this situation. In fact, in the state of Michigan, we know that only 77 individuals have completed COVID-19 testing so far. So we understand that although we have the beginning of some identified and confirmed cases, we understand that there will be much more information coming to all of us over the coming hours and days. We will be working round the clock as we have been to make sure that we are updated and that we maintain student safety as a top priority in our work. We do know that as a school district, we are uniquely situated, and we understand that we have both a role in the community and a responsibility to our students, our staff, our parents, and our community to do our part as a school system to slow the spread of the COVID-19 disease. Now, we know we heard from the governor again today with some specific information about school events and activities, and I want to reassure our board and our community that we are following closely the guidance of the disease experts and of our public health authorities. We know the best way to fight this situation is with a vaccine. That's what we would normally do in a public health crisis. But the reality is a vaccine is more than a year away. So in the meantime, we will need to pursue non-pharmaceutical interventions. And one of those interventions that we're going to set out this evening is that idea of school closure. We do understand that working parents have concerns about childcare, and I want to reiterate to our board and to our community, those are concerns we also share. We understand that in any school closing decision, we balance the tensions of the social good that schools do every day in the lives of children, their families, and our community. And yet at this point in time, we balance that social good with the significant reality of this more critical phase and the critical nature of the public health crisis that is facing us. So we will take our role and our responsibility very seriously in this situation. We do understand that it is particularly critical that those with compromised immune systems or other chronic health concerns consult their physicians, and we do have those folks in mind, and our health professionals will be sharing more about that. We heard again from the governor today the guidance about canceling school-associated congregations. And we are analyzing the size of those congregations and working with our principals who will be sharing site-based, school-based information regarding next steps with school activities and events. And so I'm pleased to have organized a task force to work on this COVID-19 situation. And at this time, 2 members of that task force, actually all 3 of my colleagues this evening are members of that task force, and they've joined us this evening to give us further medical alerts and advisement. And at this time, Ms. Jenna Bacalor, who is our health officer, our health professional who leads up this team, will begin with some information. Thank you, Ms. Bacalor.
Thank you, Dr. Swift. I'm going to advance the slide and show the presentation overview for tonight's presentation. First, Dr. Swift talked about the school's role in preventing the spread of coronavirus. We will also get into the basics of the disease, The people that AAPS is working with locally, state, and nationally around planning for our COVID response, our continuing efforts, our efforts to plan for contingencies, and then everyday preventive actions that all of us can do. So we will start with a review of COVID-19 basics, and now I will turn it over to Keely Hoffman, who is our AAPS lead school nurse.
Thank you, Jenna. Good evening. I just want to highlight a little bit regarding the symptoms to be aware of in COVID-19. And those are typically appear within 2 to 14 days after exposure. And those are shortness of breath, coughing, and fever. And how COVID-19 spreads is through person-to-person contact, typically within a close range of about 6 feet of the individual who is infected. And it is spread through respiratory droplets from the infected individual's cough or sneeze. And COVID-19 is most contagious during the asymptomatic phase. So populations at higher risk are older persons, those with chronic health conditions such as cardiac disease, respiratory issues, diabetes, and others who have immune-compromised systems. So if you should become ill, what should you do? Stay home, call your healthcare provider, and tell them what symptoms you're experiencing. And from there, you would take the advice of your healthcare provider and follow any recommendations they make in helping yourself to recover. Now, CDC, we have some guidelines recommended for those individuals who are at higher risk. So the higher risk population, we say go ahead and prepare now and talk to your healthcare provider at this time to make a plan. And parents of these students, reach out to your administrators, your principals in your building, your teachers, and your school nurses to assist in making a plan for those at higher risk. Also, we want you to take everyday precautions to keep space between yourself and others. When you go out in public, keep away from those who are sick, limit close contact, and definitely we want you washing your hands frequently. Avoid crowds as much as possible. Avoid cruise travel and any non-essential travel at this time. For those at high risk, we are also saying that during a COVID-19 outbreak in your community, we recommend that you stay home as much as possible, further reducing your risk of being exposed. CDC is recommending for individuals at higher risk that you do stock up on some supplies at home, particularly extra medication and food and supplies that you might need in the event that you are spending more time at home. And at this time, I will turn it over to Jenna.
Thank you, Keely. Now we will advance to talking about the AAPS response and further planning for coronavirus. The next slide shows the Washtenaw County Health Department. They are our most significant partner in working toward really solid plans for coronavirus or COVID-19. We are in daily and sometimes hourly communication with Washtenaw County Health Department, including by phone, email, text, basically you name it. They're consulting with us on cases and on students or staff who may have traveled and on all kinds of situations, which we are really grateful for. They're also helping us in, while we make our plans, develop those plans and review them with us and for us. If we do have cases in AAPS, they will help with coordinating and contact tracing. And just this evening, the four of us here on the panel were in communication by phone with Dr. Juan Marquez, the County Medical Director, and Jimena Lovelock, the County Health Officer, about the latest information we've received from the Governor and looking at these issues that school districts are facing. So I can't emphasize enough how grateful we are to the Washtenaw County Health Department and how much contact we're in with them. And I have a image of this nice flyer that they've developed how to be prepared for coronavirus, and it just kind of has all the tips, so I would recommend taking a look at that. Beyond the Washtenaw County Health Department, we do have primary sources for our AAPS response. And I've advanced the slide. The Centers for Disease Control is constantly putting out new guidance. We are keeping right on top of that. I'm checking the CDC guidance a couple times every single day. And they're offering a lot for the school district, both as an educational institution and as an employer. So we've received and used a lot of their guidance. We also look toward our state and national organizations that are always helpful to us. The Michigan Association of School Administrators, the Michigan School Public Relations Association, School Nurses Association, School Board Association, and also we've started looking at what other districts are doing where they've had cases. And this is important because we're figuring out their decision processes as they've dealt with this issue before we have. So let's talk about the recommended COVID-19 sources. What we have experienced is that pretty much every educational institution, nonprofit, and business and organization has released information on COVID-19. And we are really focused on the really reliable sources. The County Health Department, CDC, and the World Health Organization offers a daily situation report, which can be helpful. So those are the three that we would suggest looking at, and also being in contact with a healthcare provider if that is needed. So let's talk a little bit about what we have done so far. I'll just flip to the page. Over the past couple of weeks, we have used all of that CDC guidance that I just mentioned to make some important decisions, and some of them have been hard decisions. We've canceled school-sponsored international travel. As Dr. Swift mentioned, we've established a coronavirus task force. We've established a website, and I hope that you all will visit it. It's a2schools.org/COVID-19, and we will be updating that with messages as they're released. And we've also got parent resources available and other just helpful information available on that site. We've also clarified expectations for people entering AAPS buildings who may have recently been in one of the CDC Level 3 travel advisory countries. We've intensified cleaning protocols and disinfection protocols using that CDC guidance. And we've promoted the practice of these daily prevention habits that everyone constantly is talking about: washing your hands, covering your cough, staying home when sick. And this slide has one of our AAPS kiosk slides that shows that's in every one of our buildings, rotating throughout the day.
And would you refer to the numbers so that trustees?
Oh, sure. We
Six,
are on
8.
I can't even read that tiny little number from here.
Is it 8? 8.
We are on slide 8. This is AAPS Actions Part 1. All right, so let's talk about some of our actions that are ongoing and that are being considered right now. So like I mentioned a few minutes ago, we will be updating messages. You can receive those through your email, or you can check our website that I mentioned. We are continuing, of course, to closely monitor the COVID-19 situation in Michigan. As Dr. Swift mentioned, there have been very few tests in Michigan, and we know that there may be actually a lot more disease here than is being reported. We're monitoring daily attendance. We're reminding everybody who's in our building to use those preventive habits. We are also remaining sensitive to biases that are associated with COVID-19. We know that anyone can get this virus. It doesn't matter where you're from, and we're very cognizant of any discrimination and addressing that immediately. We are looking and preparing for potential cancellation of additional school events, and we are doing that with the Washtenaw County Health Department and others around the county and around the state. And I'm on slide 10 now, and I think I need to turn it over to Dawn. Is this your part now? Yeah. Yeah, so we've got some considerations, but you've got.
So as we know, the situation is evolving constantly, daily, hourly. As those new pieces of information come to us, we're making additional decisions about our next steps. I'd like to talk to you about the teaching and learning side of this process and what we are preparing for. So in the event of a closure, our goal is to work to continue instruction and education. Our teaching and learning teams are very busy developing plans to support that continuation. At the heart of this is our commitment to equity, and we understand that access is a significant challenge for some in our community. We're committed to developing a plan that provides equitable access to our high-quality instruction, and as you can imagine, there are many details to a plan of that magnitude. Our hardworking teaching teams will be providing you with updates and clear guidance regarding how to access materials, lessons, and supports should we make a determination to close. And for our students receiving special education services, there may be services where provision in an online setting is appropriate and effective, and of course there may be services that are not appropriate to deliver in that manner. But we will do everything in our control to ensure that students are supported and that education continues. Certainly, we will be following the guidance of the Michigan Department of Education regarding service provision as well. Many are concerned about and have asked about how we will be handling athletic events moving forward. While the MHSAA has issued guidance that most events may continue with some limits to crowd size, we do recognize that these decisions are complicated and, as we mentioned, are evolving daily. So we are working together with school principals and our executive directors to make some appropriate determinations. We will be communicating with families at the school level about individual events over these coming days in the absence of a mass decision. As I mentioned before, there are a lot of moving parts, and our effort is to ensure that our practitioners are helping to lead our plans for continuing education for students. And so we look forward to continuing to engage with our teacher teams in developing those plans. So stay tuned for those. Those updates will be shared with you often and certainly via the website that Ms. Bacalor already referenced. And I will turn this back over for some closure.
In closing, we just want to remind everyone who is visiting our school buildings and out in the community that everyday prevention is something that everyone in the community can do, and that includes the things that you're hearing over and over again, like washing your hands for 20 seconds, staying home when sick, covering your coughs, and also now is about social distancing. And now we're like a little too close together, Keely. So all of those things are ways that we can help ourselves and help our community stay healthy and free of COVID-19. Thank you. I will turn it over to Dr. Swift.
Oh my God.
Oh, no?
Okay. Thank you. I really appreciate Ms. Bacalor, Ms. Hoffman, and Ms. Linden, your excellent overview. As we shared at the outset, we have far more questions this evening than answers, and yet we do have history to inform us. And I'm just reading from an article in the New York Times by a professor from the University of Michigan, Dr. Howard Markel, and he shares that, that when it comes to outbreaks of respiratory infections, closing schools can help prevent many thousands of illnesses and death. Schools are community gathering places where large numbers of people are in proximity to one another, and respiratory infections can easily spread among young people and adults alike. Closing schools can be a key part of slowing the spread of easily transmissible viruses so that hospitals are not overrun, and it can help to buy time to allow for the development of antiviral medications, medical treatments, or a vaccine. So we started this time together with that idea of both the role and the responsibility of the school district in the community, and our obligation to consider as a community those aggressive, non-pharmaceutical interventions. And we've been told by the experts with whom we consult that those interventions include school closures, isolation of the sick, home quarantines of those who've come into contact with the sick, social distancing, telework, and large group cancellations that must be implemented before the spread of the disease in any community reaches the 1% threshold. So, and we're learning more every day, but what we do know from our scientist partners is that time matters. A delay can mean the difference between success and failure in our community. So I want the community to know, and I know the board understands this because you carry along with us the responsibility for these very grave and serious decisions. I want everyone to know we do not take this responsibility lightly. We're very busy getting the connections and the information that we need in order to inform the wisest and soundest decisions. We're basing those decisions in our top priority of student and staff and family and community health, safety, and well-being. That's our #1 priority. We are also working to ensure that any closure of schools or any cancellation of activities or events is really based in sound scientific premise and principles based on the facts as we know them, and yet understanding that because of the slowness on testing, we do not have all the information, and we're very clear on that. I want to be also clear that we do understand that in the Ann Arbor Public Schools, 1 in 4 of the students who arrive to our schools every day count on that school lunch. For some of those students, it may be the only warm meal that they get. So I want folks to understand that our teams are working now. We're in contact with the federal officials that oversee free and reduced lunch school programming. We are working now on a plan so that if we are in a position where school cancellations become the decision, we will do everything in our power to ensure that everything we can get in place on that social network is in place in a responsible manner. And so I do want to emphasize that. There was some confusion today on our message regarding athletic events. I want to be clear that we are following the guidance of the Public Health Department, of Governor Whitmer, and of all the experts we speak with, and we are canceling activities outside of school. It is true that for high school athletics, we work through MHSAA, and our high school executive director, Mr. DeAngelis, is in constant contact. So we are taking the same aggressive approach on all of our events and activities, and yet in a district of 18,500 students and more than 30 campuses, those directions will be given through the school principal because they're as varied as the number of activities going on in every building, and it isn't prudent to try to communicate all of that at the district level. So I know that we're going to turn, if it's okay, Mr. Cluley, you're with us. We're going to turn to questions now, and I know the trustees are going to forward those through my phone Here's the first one. President Johnson has asked, we have seen a few districts across the country decide to close schools. Are there specific events that triggered their decisions to close? Is there anything specific that would cause us to cancel or postpone classes? I will start from the lay superintendent perspective, if that's okay, and then I'll move to the medical and other experts here on the panel. At the beginning of this outbreak, I believe that my observation, and I have close colleagues in the Seattle area, have been in contact with them over recent days, direct contact with them. And I know at the outset of this outbreak, folks were working in school systems more along the line of the closure trigger being that first case in the school. And yet, I want to share, trustees, that what we are understanding, and this is, I believe, evolved over the days and a couple of weeks that we've been engaged in this outbreak. What we are understanding is the critical importance of proactive closure. This particular illness does not at this point appear to impact children, other than our chronically, and I want you to address that as well, our chronically impacted students. Yet, schools are the hub of the community, and so much activity coming and going, and exchange and gatherings. The governor's term today was school congregations, and that made perfect sense to me as a former teacher and principal. The cafeteria is a congregation, waiting for arrival in the morning and dismissal in the afternoon, and athletic events and concerts, and so much of what we do in education is a human-based endeavor, and so it does naturally involve congregations. So, Trustee Johnson and trustees, I know I've not given the answer, so to speak, but it does very much appear that the wisdom at this point does not necessarily involve the identification of a particular case in the school system. And so with that, Ms. Bachelor?
We do know that some of the school closures have been related to a case that has been either diagnosed in a staff person or a student in the school, or there was a suspect case in a family member. So that according to Dr. Marquez, our county medical director, if we did have a direct case impact a school, we would likely close that school. And sometimes the school closures are for a pretty brief period of time for cleaning, but I think what you're talking about, Dr. Swift, is a different approach where it's more of a community prevention, which some school districts have done. I know there's one in the Seattle area that just closed the entire school district for the foreseeable future. And of course we know that our higher education institutions in Washtenaw County have done this. U of M decided to cancel classes tomorrow and Friday and go to online for the rest of the school year, as did many other campuses around Michigan. So there are these kind of two schools of thought, but so what we're trying to balance are our medically fragile students and staff, the needs of our students, and spreading the disease, acting with the right timing in consultation with our health partners. Is that good? Okay.
Thank you. So a question from Trustee Lazarus. Should we decide to close for 2 weeks incubation period, but the pandemic persists beyond the 2 weeks, do we have a plan to conduct classes via distance learning resources, not to extend too far into summer. Trustee Lazarus, thank you for that question. It's the question that's pressing on everyone's mind. We will be working with our teachers. As everyone in our system knows, we have world-class teachers and amazing programming, and yet we will want to take time to follow the steps to do this sort of thing in collaboration. We are seeing some districts dismiss classes for a day or two in order to give the teachers, and in fact we're seeing this at the University of Michigan, giving the professors time to organize for online learning. So the emphasis that I would want to place on this decision is that we absolutely are going to need to look at an online tech-based opportunity. But we will do that in partnership with our teachers and our staff, and it will take just a bit to pull that together. Although I will point out that many of our teachers have had online mechanisms and websites in place, but I don't want to overstate on that. We would need to get that program organized. Ms. Linden, would there be anything you'd want to add?
Thank you. Appreciate that. I think you said it, Dr. Swift. I will just reiterate that equity is at the heart of our consideration. And so what we're working really hard now to determine is access to devices, access to internet, in addition to the instructional delivery mechanisms like a platform and materials and access to video and the ability to exchange lessons and feedback between teacher and student. So there's a lot of really good thinking happening, but certainly a lot of details left for us to determine. And as Dr. Swift said, we couldn't do that without a whole lot of input and connection with our teacher teams. So that's on the forefront.
Next question, from Trustee Kelly, and I appreciate these excellent questions, trustees. If families choose to keep their own children at home, will the absences be excused, or will they require a doctor's note indicating that the child is medically fragile? We will be in a full-day meeting tomorrow to work on these details, and I will be in the next 24 hours or so pointing all in our community to a frequently asked questions document where we'll be developing these answers. But I would just offer right now that we will honor, student illness is absolutely a reason by which parents can appropriately excuse their students. So we absolutely encourage parents. It's going to be excellent if you reach out to your school nurse or if you reach to someone at the school to make them aware that the parent has made the decision to keep their child home. In that case, we will follow our normal procedure for doing our very best to get the work sent home to the family. I will, because we do understand the nature of the situation, just ask for everyone's patience. But absolutely, the moment that a parent feels that it is safer and healthier for their child to be at home, we absolutely all will respect and excuse that absence. I believe that is absolutely clear. Thank you. Was there anything y'all wanted to add to that? Okay. Very good. Any other questions? Mr. Cluley, anything off of our just kind of ongoing frequently asked questions document? I know the athletics is really going to come through Mr. Paul DeAngelis, and that seems to be a point of a lot of questions. And so that'll be coming through our high school executive director who's working with our athletic directors, with MHSAA and others. And it may very well be that some things occur. Another one is the Michigan school the instrument, the music Association. We're working with several of those associations who are coordinating events that are not our events. They're not Ann Arbor Public Schools events, but our students were planning to be a part of them. So I just want to emphasize that we'll be communicating through our school principals, but on all of those events, they will be occurring in a very different way, or will not be occurring, because we will have to meet the guidance from the medical experts and our public health authorities, which requires limiting the interaction and reducing the size of the group. So I hope that's helpful. Any other questions, trustees? We want to reiterate how very grateful we are for your tolerance of this different format for a Wednesday evening. I appreciate that we are modeling what we're asking for from our community and what our governor and our public health officials are asking us for, and that is when at all possible to avoid congregating. And so that's what, trustees, you've done with your decision this evening, and yet this information and the broadcast will be available to everyone in the community. And so I'm just looking, Mr. Cluley, and I'm checking our checking email to see, are there any further questions? So I do have one question coming in on email, and that is I have received a few emails today wondering about the status of school for tomorrow. And at this time, the Ann Arbor Public Schools is open, and we will have school tomorrow. Again, if parents or students, along with families, you make the decision, we certainly respect that decision. Another question from President Johnson: when we miss school for excessive snow days, families often wonder if we will have to extend the school year to make up for that certain number of days. This is probably a premature question, but has there been any talk at any level about how we might handle this if we end up closing schools? Thank you, President Johnson. That's an area I wanted to get to, and we hadn't yet. We have been in meetings over the previous 24 hours with representatives from MDE at the state level, with our local health authorities, and then Mr. Comza was on a live call with folks out of Washington, D.C. today on this very question about how much latitude will be given. We do not have those answers today, but I will point out that the governor's wise call of a state of emergency does trigger a number of allowances around the law, various laws and around guidelines. So I felt like when we all watched her make that announcement last night, that was a signal that we would be moving into a phase of this process where requirements will be different. And we don't know the answer to exactly what those are at this time, but I think it's safe to say we are in uncharted territory with the critical nature of this public health outbreak. So that would be a preliminary answer. Ms. Bacalor, Ms. Hoffman, Ms. Linden. Okay, let me see if we, oh yes. Yes. So Trustee Lazarus asked, I know we have good relations with the city and the county and businesses. Are we coordinating with them to close jointly to maximize the effect of quarantine? Thank you, Trustee Lazarus, for that good question. I've been in communication today with city officials and with officials from the University of Michigan. We've been in direct contact, and there is a concerted effort, not only with the city and the university and the county officials, but also with the 8 other of our area superintendents. And I will share that there is a desire from leadership across all of those organizations that as much as possible, we will move in tandem so that we achieve the community effect that we all want. And I won't use the right medical term, but that community effect of depressing and slowing the spread of this disease. Anything else? We very much appreciate your time this evening, and for those who had to wait an extra significant part of your evening to see this briefing, I very much appreciate your patience. We know that many people were interested to hear the thinking of the school district. We will be publishing a frequently asked questions document. We will update that document as regularly as we have confirmed and factual information to share. I just want to share with the Ann Arbor Public Schools community, we take very seriously our responsibility to keep children safe, and we will not rest until these decisions are sound and true, pointed to our due north of children and staff and parent and family and community safety. And so these are hard times, and I know what we do in the Ann Arbor community during challenging times. We look out for our neighbor. We make sure that folks have food and that they're able to be at home safely. And I know already that even during the time of this conversation this evening, that members of our team and members of our beautiful Ann Arbor community are already thinking about action that we can all take to keep our community safe. These are uncertain times, but our core values and our community partnership is a solid rock on which we base our next steps. And I appreciate and thank everyone in the community for your outreach and for your support. We won't always agree on the decision, but we will always agree on the priority of our children and our staff and our families and our community, their health and safety. And so with that, we thank you for your time. I want to thank the members of my team who had to be here this evening to make this broadcast happen. We appreciate so very much your joining us today, and we will be back in touch as soon as we have more information. Thank you.